muscle testing for lower extremities by Jamie Blanchard, Roger Rosado, Krista Smith, Ben Smith, and Shell Holmes. And we are in the Physical Therapy Assistant Program through Mohave Community College, class of 2017. We are going to start today with the tibialis anterior. The origin of this muscle is the lateral tibia and the interosseous membrane. The insertion is the first cuneiform and metatarsal. The action is ankle inversion and dorsiflexion, and it is innervated by the deep peroneal nerve.
So to test tibialis anterior, you're going to bring the foot into dorsiflexion and inversion. You're going to bring your pressure medially and coming downwards into plantar flexion. You're going to direct your patient, hold, don't let me move you, don't let me move you. Good job.
The tibialis posterior originates in the interosseous membrane and the adjacent tibia and fibula. The insertion is all tarsals, calcaneus, and metatarsals 2 through 4. The action is ankle inversion, and it assists in plantar flexion, and it supports the medial arch. The nerve supply is the tibial nerve.
For tibialis posterior, you're going to bring your patient into some plantar flexion and inversion. The pressure is going to come medially, and this time coming medially and pushing the foot up into dorsiflexion. Direct your patient, hold, don't let me move you, hold, don't let me move you. Good job.
Next is the peroneus longus. It originates at the lateral proximal fibular and the interosseous membrane. It originates on the plantar surface of the first cuneiform and metatarsal. The action is ankle eversion, and it assists in ankle plantar flexion, and it innervates at the superficial peroneal nerve.
For peroneus longus, you're going to bring your patient into some medial rotation, plantar flexion, eversion. You're going to support your patient's ankle and bring your hand in at the lateral border of the foot, and you're going to push your pressure into dorsiflexion and inversion. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
The peroneus brevis originates on the lateral distal fibula. It inserts on the base of the 5th metatarsal. Its action is ankle eversion, and the nerve is the superficial peroneal nerve.
So for this one, you're actually going to bring your patient's leg off of the table so that you have better access to the foot. You're going to take your right hand, put this left leg here, and bring it up along the forefoot, left hand up along the calcaneus, and you're going to have your patient try to plantar flex their foot. So go ahead and hold, don't let me move you, hold, don't let me move you, keep holding, good job.
The gastrocnemius originates on the medial and lateral condyle of the femur. It inserts on the posterior calcaneus. The action is knee flexion and ankle plantar flexion, and the nerve is the tibial nerve.
Okay, so to test the gastroc, you're going to keep the knee extended. You're going to come up underneath the leg here, direct your patient to point your toes, make a little horseshoe with your hand, and basically grab the back side of this calcaneus and direct your patient, hold, don't let me move you, hold, don't let me move you. Good job.
For the semimembranosus, it originates at the ischial tuberosity. It inserts the posterior surface of the medial condyle of the tibia. Its action is to extend the hip, flex the knee, and its nerve is the sciatic nerve. You also test the semitendinosus in the same way. It originates at the ischial tuberosity. The anterior-medial surface of the proximal tibia is where it inserts. Its action is to extend the hip, flex the knee, and it is also the sciatic nerve.
To test this muscle, we have the patient point their toes medially. We pull on the back of their ankle, trying to pull them into extension. Having them hold, don't let me move you, don't let me move you. Good job.
The biceps femoris, long head, originates on the ischial tuberosity. Short head, originates on the lateral lip of the linea aspera. They insert on the fibular head. The long head's action is extension of the hip and knee flexion. The short head's action is knee flexion. The long head's nerve is the sciatic nerve, and the short head's nerve is the common perineal nerve.
Okay, to test this muscle, we have the patient put their toes into lateral rotation. We pull back on their ankle, telling them to hold. Don't let me move you. Don't let me move you. Very good.
Rectus femoris. It originates on the AIIS, the anterior inferior iliac spine. It inserts on the tibial tuberosity. Its action is to flex the hip and extend the knee. The nerve is the femoral nerve.
To test this muscle, we put pressure on the anterior portion of the ankle, pushing the ankle into knee flexion, telling the patient, hold, don't let me move you, don't let me move you.
Tensor fasciae latae originates at the anterior superior iliac spine. It inserts the lateral condyle of the tibia. Its action is combined hip flexion and abduction. The nerve is the superior gluteal nerve.
Okay, to test this muscle, we put the patient's leg into flexion, abduction, and internal rotation. And then we put pressure on the distal part of the leg to put the, try to push into extension and adduction, telling the patient to hold, don't let me move you, hold, don't let me move you. Good job.
Iliopsoas. It originates at the iliac fossa in the anterior and lateral surfaces of T12 through L5. It inserts to the lesser trochanter. Its action is hip flexion. The iliacus portion is innervated by the femoral nerve, and the psoas major portion is innervated by L2 through L3.
Okay, to test this muscle, you're going to bring your leg up, and I'm going to say hold, don't let me move you, hold, don't let me move you. Okay, good.
Sartorius. It originates from the ASIS, which is the anterior superior iliac spine. It inserts on the proximal medial aspect of the tibia. Its action is a combination of hip flexion, abduction, external rotation, and knee flexion. It's innervated by the femoral nerve.
Okay, to test this muscle, we're going to have the patient positioned like this, and we're going to place pressure against the anterior and lateral surface of the lower thigh in the direction of hip extension, adduction, and internal rotation. Hold, don't let me move you, hold.
To test the hip adductors, they are tested as a group. Hip adductors include the adductor longus, adductor brevis, adductor magnus, gracilis, and pectineus. They share common origins at the pubis and ischium. They share common insertions at the pectineal line of the femur, linea aspera, and the adductor tubercle. They are innervated by several nerves: the femoral nerve, obturator nerve, and sciatic nerve.
Okay, to test these muscles, you're going to make sure your patient's in a good alignment, and then you're going to bend the knee up, raise the leg up, say hold, don't let me move you, don't let me move you. Good.
The medial rotators of the hip include the piriformis, quadratus femoris, obturator internus, obturator externus, gemellus superior, gemellus inferior. They share various origins, insertions, and nerve supplies.
Okay, so to test these muscles as a group, you would bring the patient's leg out to here, apply a counter force right here, and try to push right here, asking hold, don't let me move you, hold, don't let me move you.
The lateral rotators of the hip include the gluteus minimus and the gluteus medius. They share an origin on the ilium. They share an insertion at the greater trochanter of the femur. They also share a nerve supply at the superior gluteal nerve.
Okay, so to test these muscles as a group, as opposed to individually, you apply a pressure on the lateral side of the distal thigh and medial pressure to the distal leg, and apply force here, saying hold, don't let me move you, hold, don't let me move you.
Gluteus minimus originates from the lateral ilium, inserts to the anterior surface of the greater trochanter. Its action is hip abduction and medial rotation. It's innervated by the superior gluteal nerve.
Okay, so to test this muscle, it's important that they're in good postural alignment. And you place one hand here to stabilize and have them lift their leg to here and put the pressure here. Say hold, don't let me move you. Hold, don't let me move you.
Gluteus medius. It originates on the outer surface of the ilium, inserts to the lateral surface of the greater trochanter. Its action is hip abduction. It is innervated by the superior gluteal nerve.
Okay, and for this muscle, it's also important that they're in good postural alignment. And you would come up with the leg in a little abduction and slight extension. Applying force here, saying hold, don't let me move you. Hold, don't let me move you. Okay, so for the gluteus maximus, we're going to bring the patient's leg into a little knee flexion, a little hip extension, apply pressure on the posterior thigh, say hold, don't let me move you, hold, don't let me move you.
Gluteus maximus. It originates from the posterior sacrum and ilium. It inserts to the posterior femur, distal to the greater trochanter, and to the iliotibial band. Its action is hip extension, hyperextension, and lateral rotation. It's innervated by the inferior gluteal nerve.
Okay, so for the gluteus maximus, you're going to bring the knee into a little bit of flexion and the hip into a little extension and apply pressure at the back of the hip, saying hold, don't let me move you, hold, don't let me move you.
Flexor hallucis longus. It originates from the posterior fibula and the interosseous membrane. It inserts to the distal phalanx of the greater toe. Its action is to flex the great toe. It also assists in inversion and plantar flexion of the ankle. Its nerve supply comes from the tibial nerve.
In order to test this muscle, you're going to have the patient sit with their ankle supported by something underneath the foot, and you're going to brace at the first MTP joint, and then you're going to have them fold their toe down, and you're going to resist upwards and tell them, hold, don't let me move you, hold, don't let me move you. Good.
Extensor hallucis longus and extensor hallucis brevis. Originates from the fibula and interosseous membrane. Inserts to the distal and proximal phalanx of the great toe. Its action is extension of the first toe and assistance with inversion and dorsiflexion. They are innervated by the deep peroneal nerve.
In order to test this muscle, you're going to place your patient into a slight plantar flexion. You're going to put your fingers on the dorsal side of the distal and proximal phalanges, and you're going to instruct your patient to flex the toe up, and you're going to resist that motion and telling them, hold, don't let me move you, hold, don't let me move you. Good.
Lumbricals. The first lumbrical originates from the medial side of the first flexor digitorum longus tendon. The second is from the adjacent sides of the first and second flexor digitorum longus tendons. The third originates from the adjacent sides of second and third flexor digitorum longus tendons. The fourth originates from the adjacent sides of third and fourth flexor digitorum longus tendons. They insert to the medial side of the proximal phalanx and dorsal expansion of the extensor digitorum longus tendons of the second through fifth digits. The action of the lumbricals is to flex the MTP joints, and it assists in extending the IP joints of the second through fifth digits. The nerve to lumbricalis 1 is the tibial nerve. The nerve to lumbricalis 2 and 4 is also the tibial nerve.
To test this muscle, you're going to place your patient into a neutral foot position, and you are going to brace at the mid-tarsal area of the dorsal side of the foot and place your fingers along the distal segments of the digits 2 through 5. And you're going to instruct your patient to push down against your fingers, and you're going to tell them, hold, don't let me move you, hold, don't let me move you. Good. In order to test this muscle, you're going to place your patient into a neutral foot position, bracing at the mid-tarsal area of the dorsal side of the foot, and you're going to place your 4 fingers on the proximal digits 2 through 5, and you're going to instruct your patient to push down and hold, don't let me move you, hold, don't let me move you. Good.
Jones, Kendall opened up. Ready for my finals, told my buddies all good luck. With my gate belt at the ready and all of my PPE. Manual muscle testing is a valuable trait. When you're in final practical, you'll have me to thank. Tammy self-test muscles, she ain't fooling me. We're manual muscle testing, lower extremities, to gauge patient strength and assess their needs.